All right. So you have a and action. You're going to have a 3-year-old cardiac arrest patient, VFib.
Okay, well, using the hand-heavy app, 13579, 3 would be 15 kilogram patient. So we're going to use 0.15 milligrams, or 0.15 milligrams of epi, 1 to 10,000. So we're going to use 1.5 mLs of epi, 1 to 10,000.
So what's the dosage?
1.5 milligrams.
What is the
That's
dosage?
0.15 and 1.5 mLs.
Yes.
Okay, but what's the actual dosage?
Would the dosage be
0.1
0.1 milligrams per kilogram?
Okay, and so how many milligrams did you come up with?
0.15 milligrams.
Okay, and how many mLs are you going to draw up?
1.5 mLs.
Okay, so let's pick the correct syringe and just draw it up.
3 milligrams.
You have a throughway?
No.
We'll use the throughway.
Oh, no, we had 2.
So explain what you're doing.
You want me to? Okay, so we're attaching a 3-way stopcock to it. We're going to leave this in the off position. Here's the epi. We need 1.5 mLs of epi. So he's going to fill this, pushing the epi into this syringe until it's 1.5 mLs.
Okay.
Let's see. There you go. 1.5 milliliters.
1.5 mL.
Okay, what size syringe did you pick?
3 milliliters.
The 3 ml
Yes.
milliliters? Okay.
That was the most appropriate syringe.
Okay, and your 6 rights of medication?
We have the right patient.
Cardiac arrest.
Yes. We have the right dose.
3-year-old, 15 kilograms.
Yes. We have the right drug. We're giving the epi.
1 to 10,000.
Yes. We have the right time because it is in cardiac arrest.
Right route.
We have the right route, IV, and then the right documentation would be the 6.
Okay.
So 1.5 mLs. Yep. We're going to attach it to the 3-way stopcock again. Turn it to the off position, so this is now going to flow from here to here.
Okay.
Push that. Turn it off. Unattach it. And now wait 3 to 5 minutes to give another epi.
Okay, so we progressed through the code and he's still refractory VFib. You've done your shock.
We're going to give a dose of amiodarone.
Okay.
Amiodarone is the same as epi in
But what's the actual dosage of amiodarone?
0.01 milligrams per kilogram as well. No.
No.
0.1 milligrams per kilogram, sorry.
No. Try again.
0.5.
5 milligrams per kilogram, sorry.
5. We got a winner. 5 milligrams per
5
kilogram.
milligrams
And
per
then what is it
kilogram.
packaged?
Forgot.
That's the wrong one.
It's packaged 150 mLs per 150 milligrams per 3 mLs. And we give that, so 5 milligrams per kilogram. He's approximately 15 kilograms. So 5 times
75.
45 milligrams.
Is it?
Okay.
45 milligrams. 15 times 5. 15 times, no, 75, you're right. Sorry.
Okay, so how many mLs are you going to draw up?
1.5.
1.5 mLs.
Package 150 to 3 milliliters, so half that would be 75.
Yes. Okay, so you have to use the actual meal this time.
Okay, so once again your cross check.
Yep.
The right patient.
Right patient.
We have the cardiac arrest
Yep.
in the 3-year-old. The right dose, which is going to be 75 milligrams, which will be 1.5 mLs. We're going to use the right route, IV. We're going to use the right time, because they're in VFib, and the right documentation, V6.
Sounds good.
Okay, so how do you know you didn't grab what's kind of close to amiodarone?
Would be
Yep.
adenosine. I guess it's close.
He's going to double check with me to make sure it's
And double
the
check
right
with the
drug.
vial that you picked up. So
And
you
that's
actually
not out of date,
Right.
and it's right, and it's clear, and everything's right.
That's a stop.
okay.
That's better off without the stop.
No, it's not.
You're in the wrong hole.
Try this too.
It's in there, I swear.
I think you're a liar.
Oh, you're recording.
All right, so we have our newborn baby here. We're guessing he's about 3 kilograms.
Under a year old.
Under a year old. Okay. So Kennedy here is going to use a Jamshidi.
And then you make the needle smaller so it doesn't go through the leg.
Since
How
we
do you
have-
do that?
You twist it up.
No.
Okay.
So since it's a small leg, we're going to put a little brace underneath the leg here so we can get some stabilization. I'm going to prep this pigtail for my partner.
And then you go under the knee on the, what is it called?
Tibial tuberosity.
The flat part on the medial side.
Are you going to clean it off first?
Oh, yep. So you clean it off. And then you twist it back and forth until you feel a pop. Then you screw off the top and then remove the needle.
So we're going to add our pigtail, but this stabilizer won't work quite for it, so we'll use some tape. Just hold that in place for me. If this was a conscious patient, we would consider lidocaine, 1 milliliter in our 9 milliliter flush. We have a 3 kilogram patient, so 10 milliliters per kilogram would give us about 30. We have 50 in here, so we're only going to give up to 20.
So before you push that, how would you know that you have a patent line?
We're going to draw back. We're going to push a little bit, and we're going to draw back and look for blood. And we're good. So we'll push this. Push our 30. And we'll hook up whatever we want to hook up, and voila.
What about, do you have your 3-way stopcock on
Yes,
there?
ma'am.
Okay. And how do you know it's open or closed?
This side is off, so all of the ports are open. Turn that way, this side is off.
And which way is the fluid going to flow?
The fluid is going to flow in the direction of the arrows.
What, are the arrows off or the arrows,
Right now they're on,
they're going that
going
way?
horizontally.
Okay. Perfect.
Yes.
And what's some reasons you would start an IO on a pediatric patient?
Cardiac arrest.
Cardiac arrest, we need to get a quick line established fast.
Inability to get an IV.
And what meds can you push in the IO?
Anything you can through an IV.
Okay, perfect. Great,
Action.
thank you.
All right. So first we're gonna move over here.
Okay, so first tell me, before you just go ahead and clean it, why would you start an IO on a 20-day-old?
Really, the only reason for me would be a cardiac arrest.
Yes,
to be
cardiac
honest
arrest
with you.
and-
Otherwise, I don't need a line in this kid.
Okay, so you're going to go on the assumption he's in cardiac arrest, or you're going to get a line. So, okay, we'll go with that for now. So how are you going to find the location?
With my knowledge base.
The tibia tuberosity.
Okay.
So it's like the plateau of, there's that flat part
Okay,
right below the patella.
okay, that's the flat part. And what would be a contraindication
For
to start at that
For
IO in
an
that
IO?
particular place?
it's be a fracture.
Okay.
It's proximal to.
Okay, so you found your location, you decide you're going to need to do this, and then you're going to clean off, right?
Yep. Small.
Come
small
into
circles,
the, come on, partner.
Small circles too big, going outward.
Okay.
So then,
Now, let me ask you something. Is the bones pliable in a kid's leg?
yes.
Okay, so if you just go to poke, is that really going to...
No, you have to twist.
How about some support for that leg?
True. But then don't you run the risk of stabbing?
You don't want to put your hand there because you could stab it. What
Oh,
about
shoot,
something
this
like
towel.
a towel or a SAM splint or something to support that leg?
For sure.
Give you a little support. You know.
Okay.
By the way, we obviously have our PPE
Yeah, our
on.
gloves are on.
Yeah,
I'm wearing
obviously PP is on
goggles,
it.
so I have my location. I'm gonna press till I feel bone, and twist until it pops.
Okay, got a pop.
And I
Once you pop, you can't stop. But you do because you don't want to go too far.
I remove my needle.
I'll discard this for you, partner.
Thank you. Sharps. So then I would aspirate backwards to make sure I have bone marrow, and then flush.
Okay.
Then I would secure the IO with IO stabilizer or tape, or
Okay.
like 4x4s and tape.
And what else would you put on it to take that flush off? Take the flush off? What else would you put on that?
Just a little bit of a
freeway
stop cock.
Stop
Okay.
cock.
And explain how the fluid flows through that three-way stopcock. How do you know you're going in the right direction?
It has to do with the way your little thing here is pointing.
Okay.
Your little valve, yeah. Thank you. So this way it'll be off.
Which way is off? So show me
This
which
way.
way the fluid's going to flow.
It's gonna flow. That's a good question. In this position.
Like, okay. So this way we could flow fluid this way straight through
Right,
from
yeah,
that side.
okay. So then this way they would flow that way.
That's gonna block it out from entering the
Right,
actual.
right.
Okay. Now let's say this, you're trying to give fluid. Right now, we're going to give fluid to this kid, and he is 20 days old, and he weighs 3 kilograms. So what is the fluid dosage for a 20-day-old?
Is this trauma related or just regular?
It doesn't matter.
That's 10 milliliters per kilogram.
Okay, and if he weighs 3 kilograms, how many cc's are you going to give him?
30 cc's.
Okay, so how would you administer that?
Carefully.
Be a slow.
So what do you got there?
This is actually 50 cc's of fluid in a large syringe. So I would not be doing this whole thing.
Connect.
I could connect that and subtract out 10 at a time using another syringe, or I could just squirt it out, honestly. into
Make
a
sure-
trash can.
Make sure our valve is correct, and I would bolus 30 cc's.
Okay, so you could take a empty 60 cc syringe, take your IV bag, pull out 30 cc's, and then inject that into there, right?
Yes.
Okay.
Theoretically, you don't want to go too fast, though.
Right. Correct.
You don't want to drown the patient.
To me, it kind of seems like it works out well with you and everything that's going on. So that was the good part of it. The other thing which I was very impressed with is that even on the dummy, Bronson caught that they had a right Vincent, and Tim and I were sitting here watching the lung. The actual right lung was inflating like about 3 times the other one, and he caught it on the dummy, and you guys addressed it immediately. So that was outstanding. I mean, confirmed it with the stethoscope, they fixed it, and it went back to normal. We sat here watching the whole time. So it was actually really, really good. The other thing too, again, remember, reassess your patient, because just like Justin said, you guys had no RSI going on, right? So he sees to get on you. Okay? You got to reassess that. Head to toe again. Head to toe. And Justin was right also. You're not going to RSI somebody and get them to stop seizing. Right? It doesn't work that way. So, again, how else do we find out if they're still seizing, if their body isn't seizing? Right? So until they check, once did a reassessment, I tried to make that dummy blink and do about everything else I could. Somebody jumped on us.